All right, back with Dr. Antenucci. Dr. Antenucci, we have been talking about how missing teeth can, wreak havoc in the mouth. They get all kinds of crooked. They start falling apart. They start, like a crowbar, start shifting other teeth out of alignment. You might even get headaches and shoulder pain, and even gum disease. Tell me, is it true that when a tooth is missing, and the root of the tooth is gone, that the bone starts shrinking, and that kind of like that shrinking bone has an awful lot to do. I mean, there are all kinds of clinical implications of, why bones shouldn't shrink and why it's difficult to keep teeth in it. But what I want to pay attention to it now is shrinking bone, like our grandparents. There was no implants at the time. They had dentures, and they had, apparently because of it, shrinking jaw bones, and they started looking caved in, ugly like a dried out tomato. Does a missing bone shrink the tooth, and a missing tooth shrink the bone, and does a shrunken bone have that effect? Obviously one tooth will do less damage than all teeth, but is there some truth to that?
Sure. When a tooth is lost, the bone goes away. That's just the fact of life. Bone is there to hold in teeth, and when we lose our teeth, the bone, little by little, just recedes. And that's a problem. It's hard to place implants when there's no bone. It's hard to build a bridge that sits really nicely on the gums without catching a lot of food when there's no bone. So when a tooth is lost, I really like to see the tooth replaced sooner than later.
Right, because otherwise it's difficult to replace other teeth. But what about the fact when one has a bunch of missing teeth, maybe even kind of like all of them, and gets a denture which doesn't put an implant in it, which doesn't replace the root of the tooth, and then the whole thing is shrinking? Is it true that a person starts looking, adding a bunch of years to his face, which otherwise he would look a little younger? Does he start looking older when those bones are shrinking?
Well, when you lose your teeth, you lose your support, and your face changes. You lose the bone that's holding the teeth in place. Your face is going to change more. It adds wrinkles. It adds there's less volume. There's more folds in the skin. It definitely has an effect in terms of aging. Yes.
So basically, a dentist not only can, as you said in another video, by making sure the mouth is aligned, the bite is aligned, everything is the way it's supposed to be, maybe help to prevent headaches and muscle tensions, which in itself, it couldn't be pleasant to walk around with that stuff. So now what you're telling me, also keeping your mouth proper, making sure that you have all your teeth in it, making sure you get no bone loss, can also prevent you from looking older than you really look. Basically, can you help look more pretty? I mean, that's quite a statement.
Well, it's a very true statement, though, and we see it all the time. I have patients that come in. We'll have a woman in her 50s or 60s coming in to say, "Can you restore the way that I looked when I was 30?" What they're really saying is they're seeing things around their mouth that weren't there before. Not all of them are caused by teeth, but teeth add to the picture. And when you're missing teeth, when you're missing bone, it has an effect that can be helped by restoring that, by replacing what was missing. But it's something that's, if you take care of it at an early stage, it's much easier to deal with.
Well, is it true that very theoretically, in a very, very high percentage, maybe not 100%, but very high percentage, that dentistry happens to be the branch of medicines which is the most preventive? Basically, if you do your brushing and flossing, if you do your hygiene, here and there your deep scale cleaning, and do the other tiny little work which is needed, the truth is that you probably will have teeth at the age of 85, and that's all there is to it.
That's true, especially today, with the fact that we have fluoride, which has strengthened the teeth of just about every child that's growing up. Teeth are strong. They're not going to get decayed as easily. So it's up to us to properly take care of them, probably more so than in any other areas of our body. We have control over the health of our mouths. And it's very simple. It's what you've heard all the time. Brush and floss. Clean them. Make sure you keep the bacteria off of them. And if that happens, then you have a chance, a very good chance, a very strong chance of holding on to your teeth for your lifetime.
Well, what intrigues me here is, we see literally $1 billion industry on wrinkle creams and stuff. And as you said, not every wrinkle comes from your teeth. But boy, if there's a few wrinkles and a caved-in face, as I said, at this dried out, no wrinkle cream can fix that. And going to a dentist, and if you happen to go too late, that you do have some missing tooth, well, at least realize that with today's implant, you can give the mouth the function like there would be a tooth in it, and you avoid looking 5 and 10 years older. And that's just amazing to me. Dr. Antenucci, thanks for shedding light on that and confirming that, dentists are actually cosmetic surgeons for that much.
You're welcome.
Thank you.